Hello, pod people. This is Home Care, you say? We are thrilled to be joined today by Angelo Spinola of Pulsinelli. I am Mike on the mic, and we are going to get into some very interesting home care news. So, before we get started, Angelo, can you share a bit about your experience in employment law and how it intersects with this home care industry?
So I am an employment lawyer, as you said, and I have been doing this for about 25 years. And what you find is there are lots of employment lawyers out there, but not so many employment lawyers that really understand the industry. And there are some very unique pay practices, issues that are very industry specific. And so that intersection of understanding both employment law and industry issues like how do you pay a live-in caregiver and what do you do around sleep time and what are the requirements for domestic worker bills of rights all across the country and what is pay per visit and how do you accomplish pay per visit under the fee basis regulations of the Fair Labor Standards Act and those sorts of things. Um, that I've been dealing with all of my career. And what I found is it's really a niche area that you can, it's a gift that keeps on giving. Once you get in this industry, you stay in this industry. It's kind of like The Godfather. You can't get out even if you wanted to, which I don't. I love this industry, and I've just found that that expertise has really served myself and my clients well.
Excellent. And, what you touched on there, trying to get out, it's something that really, once you're in that deep, you become the expert when you're doing this for 20 years. On a recent episode, we even talked about just verbiage in the home care industry, how confusing and unique it is from other industries. So yes, once you get a grasp, you're definitely going to take the reins and going forward and be able to guide people. And it is fun. As you said, like it's something that you don't want to get out. I don't either. I loved it. 30 years I'm in home care, healthcare, and I think it's the best. You teed up the so many changes with legislation, laws. So, for our listeners unfamiliar with that HR1, or most commonly referred to the one big beautiful bill, we can't stop talking about this, and so many things have come out, good, bad, etc. So, can you explain a little bit the significance for home care providers and workers as it relates to HR1?
Labor and employment update is most likely the reinstatement of the live-in and companionship exemption. That has not happened yet, but that will happen most likely early 2026. And that's going to have a significant impact on the industry. What that effectively means is that under federal law, there will not be for companions, those who meet the definition of companion, a requirement to pay minimum wage or overtime. And under federal law for live-ins, it'll be overtime. There's not a legal requirement to pay overtime. There's going to be a hodgepodge, though, of impact depending on what state you're in, where some states, because they have independent overtime and minimum wage laws, will still require that, whereas others do not. So I think you're going to see, and we've already been talking to a lot of the private equity backed providers and the strategics that are across multiple jurisdictions where they're going to focus their efforts for transactional purposes, right? Where they're going to buy other agencies, where they're going to invest more resources to focus on some of those industries that have more favorable reimbursement environments and more favorable labor laws, right? And the ability to have more flexibility to pay caregivers differently. I don't think caregivers are going to get paid less than they're paid today because of the market forces. If you were to pay them less, then they're going to move to a different industry. We've already seen that. But I do think that the composition of the way they're paid will be different, where there'll be, instead of overtime, there'll be bonuses incentivizing folks to stay longer. longevity bonuses to work more hours with a single agency now that hours aren't going to be capped at 40 hours in those states that are more favorable states. So there's going to be a lot of modifications there. And then I think we'll see increased litigation in jurisdictions like California, right, where it's not going to be impacted, and you still have the ability to bring a class action like case with PAGA claims, Private Attorney General Act claims. So I think there's going to be a lot of shakeup there. The question I think that most providers are asking now, at least when they call me, is what's everybody else doing and when are they going to do it? Try to figure it out and how to be the employer of choice and really incentivize caregivers to work for them as opposed to the competitors. Other areas we've seen a real localization of employment law now that Congress is gridlocked. It's been gridlocked for a few years now, where states and municipalities are taking um, the laws into their own hands and updating laws and adding um, employer rights, things like paid sick leave, wage transparency, ban the box kind of laws. There's lots and lots of laws that are happening at this local level that I think it's very difficult for the provider, particularly the multi-state provider, to keep up with all of those changes. And some of those laws are strict liability, meaning if you haven't gotten it right, whether you knew about the law or not, then there's a per se violation, and it's a per occurrence fee or penalty that you're paying, and that's creating, particularly around I would say the applicant side, where somebody's applying, and let's just take wage transparency as an example. In the job posting, we don't identify what the range of pay is or what the benefits are in a jurisdiction that will require that. That applicant is now bringing a class action lawsuit on behalf of all applicants over the last however many years the statute of limitations is for, and asking for $500 per applicant or whatever it is. So those cases can add up to millions of dollars very, very easily. And it's difficult, I think, for the provider to keep up with all of those things. So in particular, those laws that apply specifically to our industry. So for example, a unique minimum wage, like what New York has, that's, just for caregivers, right? But doesn't apply to other types of industries, or the domestic worker bill of rights laws that only apply, they only require, say, an employment agreement for a live-in caregiver, but not other industries, right? And so that those kind of issues aren't covered broadly in the press, and sometimes home care providers aren't aware that those changes were made. So exceptionally important these days for the provider to stay on top of legal changes and what's going on in their jurisdiction, and trying to get into quick compliance, be compliant before the law actually changes.
Yeah, I think a lot of people that will be listening are gonna try to avoid the per se, penalties. Yeah, that's probably something they wanna avoid, definitely. Uh, how about in terms, again, sticking with the caregiver, uh, based on all these changes, based on new law, uh, do you see agencies reducing service hours or shifting to a different type of home care delivery model as a result of this?
I have seen a great deal um, of diversity in payors. So one of the things we do here is we work with clients to open up new areas of business, to get licensed or apply for new kinds of services. And we're seeing a lot of that, a lot of diversification around like structured family, caregiving, getting into programs like that, and not having all your eggs in one basket. I mean, it's remarkable. We talked earlier about reimbursements and HR1 and what that might mean for Medicare and Medicaid. It's remarkable when you look across the different service lines, how many of them are really not profitable or break even, or sometimes you're carrying a loss. Um, so that obviously is going to need to change. And I know a lot of the work that you all are doing is advocating to help with the education and the change that's needed in making sure that our reimbursements match our environment, right? And what we need to pay caregivers and what we need to do to stay in business as a provider. That work is absolutely essential. Um, but we're seeing a lot of that diversification so that if something happens like in New York with the CDPAP, program just shutting down, but for one provider, right, and everybody else being out in the street, that it doesn't shut down your business, or if one arm becomes really unprofitable, right? Let's make sure that we've got VA and we've got, Medicaid waiver and private duty. We're seeing a lot of that, and even alternative models, in some instances, matchmaking type models, that are foreign to the traditional provider. So I think we'll see that, hopefully we will not see too much of a reduction in service hours. That's certainly a possibility. Obviously, if there are fewer covered people, that might be the case. But the hope is that we can, with the change in the reinstatement of the uh, domestic worker exemptions, we can see more service hours going to fewer caregivers, right? And address sort of the workforce shortage in that way, where our good caregivers that really want to work a lot of hours will have the ability to do that without being artificially cut off at 40. And again, that's not going to work for everyone because of the state laws and the state issues around pay practices in some states. But I think, hopefully we'll be able to, centralize some of those hours to our best caregivers moving forward.
Perfect. And in the middle there, you kind of teed up the next thing I wanted to get to with you. So yeah, Hearts for Home Care, big advocacy group. So what role will these home care advocates have to play in everything you just laid out?
Yeah, I think it's essential. I think advocacy is more essential than it's ever been. I mean, we say that every year. It's true, right? It just becomes more and more important to have a voice specifically for this industry, which probably starts with education. I mean, there are still many, many lawmakers that do not understand the difference between home health and home care and what kind of role we play. We keep seeing, I know you've seen this more often than not, right? That it's a lawmaker who's had the experience of not being able to get care, for mom or dad, right? Or a relative, right? Not being able to get quality care, not being able to get off of a wait list. That's when our politicians and lawmakers become advocates. And I think that rather than be so reactive, what we really need to be doing is pushing our agenda and making sure that lawmakers understand what we do, how essential it is, how it saves money in the long run, because it is the lowest cost care setting that there is. It's preferable for everyone. I do think people understand that the client, the patient, they want to be aging in their home. They want to stay in home whenever possible. We've got the technology now to be able to do that in almost all instances. So we just need to make sure that, we've got the advocacy, we've got the support, right, to come up with the strategies and the plan to make sure that care can be affordable and that providers can stay in business. So, love what you do, and keep it up. Really, really important.
Thank you. And our first episode, we actually had Pennsylvania State Senator Kyle Mullins on during the federal government shutdown and while they were waiting to pass the budget in Pennsylvania, with not a lot, but some effect of changes that were made, HR1, other impacts on that stalemate. And we really got to, what you just said. It's really hard with the turnover on the state and federal level. Legislators keeping them up to date. That's what we're supposed to do. But he mentioned, we talked about how sadly it's what you said. Like if the lawmaker doesn't see it or experience it, they're being told 10 different things about 10 different industries every day. So until you get that personal feel, it's sad that they need to see it or feel it, but it's true. Until you do, you really don't get the impact it has. So we appreciate that. Closing closing this off, from your perspective, what's one piece of advice to home care executives navigating these changes, coming up in 2026?
Two pieces of advice. Am I allowed?
Two, it's all yours.
One is to get involved, right? Because as you know, it's the provider, right? The voice of the provider, particularly the constituent, right? That makes a difference. The voter, right? That has an influence that can go and meet with the legislative body, the congressman, whoever it is, right? That's making decisions that impact the provider. That local provider makes a huge difference. And I don't think we get enough of that. I don't think we get enough of connection and involvement there. So that's one. And the other is to really stay proactive around compliance as all the regulatory changes come into play, the labor changes, all the different things continue to happen. Right? Really staying apprised and forecasting out what your market is going to look like. I think that's really important. And then just staying on top of the changes so you can be proactive and not reactive. One of the things that we do a lot with clients are health checks. We call them health checks, where we'll come in almost as though there's a transaction and do a mini diligence into what is your regulatory, footprint look like. How are we doing there around HIPAA, around all the various fraud and abuse kind of issues, and then where do we sit from a labor perspective? Are we doing things the right way? What does payroll look like, and what changes can we make to protect the business better and to be prepared in the event that there's a rainy day? And often that exercise prevents the rainy day from ever coming. So I would just say that, being focused on that, putting that in the budget and dealing with it before it becomes a major, major line on the budget, right? A major line item is a great thing to do. And the providers we work with that do that, they just have a different risk profile and litigation profile than what we typically see.
Understood. Well, thank you very much. We really appreciate you providing a lot of input, a lot of tips, and I think also letting people know that you could help. That's what we're here for. We want to provide a lot of opportunities, connect with people that could help guide them through this issue, because we just want to, at the end of the day, see as many people get care in the home that need it, and all of these things all align with that purpose. So thank you again, Angelo, for joining. We really appreciate it. And pod people, we'll catch you on the next episode.
Appreciate it, Mike.